All right, guys, welcome to the urinary system. So I would highly recommend that you get out the student note packet that I posted for you and just follow along with some notes here. Like I said, if I start to go too fast, that's the beauty of online learning is you can pause me. All right. So what I want to look at here is if you're looking at this view, what you see is the kidneys, all right, and sort of the back sort of region. And you don't see any of your abdominal viscera. So one thing I want you to notice is, oops, let me go back, right, is if we look at this covering right here, all right, it looks like it's been cut away. And this actually covers this whole area, and it's called the peritoneum. So if you remember from first semester, we talked about the parietal and the visceral pleura and pericardium. And then in the abdominal pelvic cavity, we don't have specific coverings like pleura and pericardium that are specific to the organs. We call all of the serous membranes in the abdominal pelvic cavity parietal and visceral peritoneum. So this is going to be your parietal peritoneum, because where would your visceral be? Surrounding each and every organ. So this is the back of the peritoneum, and the peritoneum actually runs, all right, and this would be the back wall of it, and it's cut open, all right? And so when we talk about where are the kidneys located, the kidneys are retroperitoneal, because they are behind the peritoneum. Okay, so what we should see is you should see a whole covering, this peritoneum here, and then in front of the peritoneum, you're going to have your liver, your stomach, your intestines, your gallbladder, all right, all of those organs that are typically found in your abdominal cavity, all right? So if we take all of those organs out, all right, you get the back of the peritoneum, you cut through the back of the peritoneum, and now we can see, right, tucked back here, our inferior vena cava, our aorta, right? And then you can see your adrenal glands here and here, right? And then your kidneys here and here, right? As your kidneys create, so essentially the purpose of your kidneys is to receive blood, right, from these vessels. All right, we're going to filter that blood and we're going to clean it out. All right, we're going to take out anything that is either toxic waste, unnecessary, so we have too much of it, all right? And we're going to filter it. We're going to form it into urine, all right? Anything that's needed that we can reuse is going to go right back into your blood, all right? And now your blood's super clean and it can go on its merry way, all right? The urine that was formed, all the substances that were filtered out of the blood and are now part of your urine, are going to travel out of the kidneys through the ureters. So here's your ureters into this temporary storage tank called the bladder. Okay. The bladder is going to just continue to expand. And so you might notice if you have to go to the bathroom all the time, all right, even though you're not drinking a whole ton of stuff, you might start to think that you have a really small bladder. Well, really what happens is if you are going to the bathroom when you don't really have to, you mix up your nerve signals. So what happens is your brain starts to think that your bladder is more full than it is, all right? And so you start to feel the urge to urinate before your bladder is actually full with very much urine. So if you're going to the bathroom and there's not very much coming out, but you feel like you got to go, you might just be going too often, right? You might have messed up your nerve signals. And so that is treatable though, okay? So basically don't just go to the bathroom because it's convenient. Wait until you actually have to go, okay? When you do actually have to go, that urine then comes out this opening from the bladder, the urethra, right? And so we got lots of U's, ureter, the tubes, urinary bladder, temporary storage tank, and urethra, the opening from the bladder to the outside. So this is how we get the urine out of us, okay? So let's talk a little bit about functions, all right? We have three main functions: excretion, elimination, homeostasis. So excretion just means that we're going to take any products inside of our blood, all right, that are no longer useful to us, okay? So usually waste products or anything that we have excess of. So that's why sometimes you have to pee more when you drink a ton of water, because if you have a ton of water in your body, it's really great for your kidneys and for your blood, because you're able to flush your system often and get all these toxins and waste products out, right? It just kind of can be a little inconvenient for you because you have to keep going to the bathroom, okay? But your body isn't holding on to that extra water because it can't use it, right? So we're allowed to get rid of it. On the flip side, if you're not drinking enough water and you notice that you're super dehydrated, you might not go to the bathroom very much, and when you go, you don't have a whole lot of urine, so your concentration's lower, and it's really, really dark. And the reason why it's really, really dark is because there's more solutes and waste in there, and there's not very much water. Because if you're not giving your body enough water, we can't afford to lose it in urine. So your body has a process in which it will hold on to it, right, to basically save you, okay, until you rehydrate yourself. Elimination, that's just getting that urine out of the urethra from the bladder, okay? And then homeostasis is super, super important here, and this is how kidney failure can lead to death, essentially, is that you are now regulating your blood volume and the chemical makeup of your blood in terms of your electrolytes, your ions, etc., in order to make sure that everything is working properly, okay? And so we're going to get into that. That's more of the physiology. Okay. So I'm just quickly going to talk about the excretory. Sometimes we hear this term excretory system. It's not a true system. It's a combination of these four systems, okay? So to excrete means to eliminate or to get rid of, right? So in the urinary system, we get rid of organic wastes, right, in the form of a liquid. Integumentary system, if you guys remember back to that, we get rid of water, salts, some metabolic waste through sweat, right? Respiratory system, please tell me we know which waste product we're getting rid of here. Yes, carbon dioxide, right? And some water, right? And the digestive system, we're getting rid of our solid waste, okay? Water, bile, salts, etc. Okay, so all of these together would make up what we call an excretory system, but it's not a true system, all right? As you can see, excretion is a function of these four systems. Okay. So I sort of talked about where the kidneys are located retroperitoneal, but if you look at this picture, you get a good idea of where the kidneys are in relation to your ribs. So as you can see, this is actually why we have floating ribs. Floating ribs are going to protect our kidneys, all right? And so that's the sole purpose of your floating ribs right there. So that's about where they are, around your 12th rib, all right, between T12 and L3, all right, and you have some support there, okay? However, you know, when I worked at Iowa, we had a couple football players that when they reached up to catch a ball, their pads were no longer protecting their kidneys, and they sustained a really, really, really tough blow to the back. And the next day they woke up and they were urinating blood, basically, because their kidneys were bruised and there was a hematoma in there. And so we had to go through a lot of testing to make sure that their kidneys were still functioning properly. Okay, so you can have injury to your kidneys due to trauma like that. All right, sometimes if you go into the doctor with back pain, they might pound on your right and your left side of your lower back and just ask you if it hurts. All right, and then again, they're testing for a kidney infection there, because if the kidneys are infected, back pain is one of the common symptoms. All right. So I talked about how the kidneys are retroperitoneal. So if we look at this picture here, this outline shows you the peritoneum. We looked at sort of, all right, inside here is all your abdominal organs, all right? So if we cut through your skin, we cut through your muscle, your abs, and your fat, and now we cut through the anterior portion of the peritoneum. Now we can take all of these organs out. Now we got to cut through the posterior part of the peritoneum, and now we can see the kidneys, right? And so think about it. If you're going to have surgery on your kidneys, do you think this route is the best route to take? Probably not. You don't want to take all this stuff out. There's too much risk for things going wrong. So when we have surgery on our kidneys, they enter from the back because your kidneys are in your back. Okay. All right, so if we're looking at what tissues are going to support it, all right, you have a fibrous capsule, right, that surrounds the actual kidney. Okay. Right, this fibrous capsule, like it says here, is going to help prevent kidney infection. So it's just another like layer, right? We can also call it sort of like a visceral membrane, a visceral serosa, right? What you'll see it being called more commonly, other than fibrous, is renal capsule. Remember, renal always means kidney. Okay. Then you have your fat capsule. So this fat capsule is really important because it's going to help anchor. So all this yellow fat in here is going to help hold your kidneys in place. It's going to help attach it to where it needs to be. All right. And there's a condition called renal ptosis where the kidneys actually drop and they fall out of their normal position. And so people with really, really low body fat sometimes are at a higher risk of something like that. All right. And then lastly, you have your renal fascia, all right, which you can see around here. It's kind of that area, right? And this is it's going to help anchor the kidneys because, again, they're heavy and they're sort of seated up at the top, sort of middle, I guess, of your back. Okay. So what I'd like to do here is just allow you guys a chance to check your answers, all right? And so go ahead and take a minute to do that. I'm going to pause. All right, I know everyone was 7 for 7, so good job. All right. Let's take a look at sort of, oops, sorry, let me going a little too fast there. The organs of the urinary system. So we talked about the kidneys. All right, this is where all of your urine is going to be formed. All right. How does that urine get out? Again, one more time, the ureters. Okay. Takes urine to the bladder. It'll stay there until you have to urinate, and then it'll exit through your urethra. So we had like a pathway of blood, a pathway of air. Now we have a pathway of urine. All right, so we are going to come back to this picture, right, in video number 2.